I rise as the incoming co-chair of the Congressional Women's Caucus to talk to you a little bit about the impact that repealing this health care law will have on women. As you all may be aware, women are twice as likely to be dependent upon their spouses for health care, and they are less likely than men to have employer-sponsored insurance. As single female heads of households, of course, this has a devastating impact on the entire family when there's no health insurance. Of course, all of us have heard stories from our district about how the repeal of this law will have on women, and I heard such a story just yesterday. Meet Nicole Lipsky. She's 25 years old, working part-time and going to school part-time, but because of the health care law, was able to remain on her dad's insurance. And lucky for her, because just last week she had an infected pancreas and had to have her gallbladder removed in an emergency surgery, which cost $13,000. That fortunately was covered by her parents' insurance. You know, this law outlaws gender rating. Insurance companies, of course, charge women higher premiums than men for coverage. And it also has a disparate impact on women with respect to pre-existing conditions. When you consider that being a victim of domestic violence is considered a pre-existing condition. Now, you don't have to be a Harvard economist to know that this law is not a job killer. But we do have a Harvard economist to back us up. David Cutler, a professor of applied economics at Harvard, released a study just on January 7th, finding that repealing the health care law would destroy 250,000, you yield 15 seconds?
15 seconds.
250,000 to 400 jobs annually. And many of these jobs will be women's jobs. CNAs, LPNs, X-ray techs, RNs, and the cleaning woman who cleans up the emergency room. This law is a game changer and a lifesaver for women's health and employment opportunities for women.